Hello, my name is Cameron Holloman, and today I will be explaining the issue of clinical empathy to the officials of the Doctor of Physical Therapy programs and proposing a solution. Overview. So what is clinical empathy exactly? It is actually a skill of understanding how a patient feels and then effectively communicating that understanding to the patient. Why is clinical empathy important? Clinical empathy is very important in physical therapy because patients seek their therapist to show them an empathetic attitude in a clinical setting because it improves their recovery process and contributes to a happier and a healthier patient and therapist. What is the issue in the field of physical therapy? Physical therapy is a career field that requires a doctorate degree, meaning about 7 years of school, and it is proven that throughout school, therapists' empathetic attitudes begin to decrease. This is becoming a bigger and bigger problem because an empathetic attitude is one of the most important skills that a physical therapist should possess. So, what are the facts and the statistics? This is a graph that shows the mean empathy scores of students throughout their years of school. And as you can tell, during their first years of school, empathy scores were up, but then they gradually decreased each year, whereas therapists should end their years of school with a very high empathy score rather than a low score. So basically, to improve the career field of physical therapy, we want to flip this data. So what were the previous solutions and what has already been tried? So although only some realize the severity of the lack of clinical empathy in physical therapy, Doctorate of Physical Therapy programs do use patient interaction videos to display clinical empathy. However, these do not have a long-term effect, nor do they only focus on clinical empathy. So sometimes they can be focused on other skills rather than only focusing on empathy and helping the therapist realize how important it actually is. So this ultimately means that these patient interaction videos are unsuccessful in some means. So what is the proposition and what is my goal? I am proposing a solution that will enhance patient interaction videos to make a more long-term solution. And the goal of my proposition is to introduce the issue to physical therapists by creating a required course in a Doctorate of Physical Therapy program that is solely focused on clinical empathy, which will ultimately strengthen physical therapists' empathetic attitudes and lead to better recoveries for patients and happier patients. So what are the steps? There are a few vital steps in creating this course. With the first step obviously being creating a course that is only focused on empathy in a clinical setting and then adding it to the Doctor of Physical Therapy program curriculum. The next step is to make this course a requirement in the program for the student to obtain their degree. So they must pass this course that is mainly focused on empathy and realize how important it is before they can ultimately get their degree and become a physical therapist on a daily basis. And then the next step is to introduce the problem and teach students exactly how to show the needed empathetic attitude toward their patients and the importance of clinical empathy. So practicing an empathetic attitude is also very important in a clinical setting to effectively teach clinical empathy. So doing practice on dummies or just practicing in general in class, practice on showing their empathetic attitude in class will ultimately help them in the end. And then the final step is to test out of the course. So by passing a test, it shows that a patient has proven they are ready to show clinical empathy on a daily basis and they know the importance. So the solution. By creating this course and making it a requirement that's only focused on just clinical empathy, will promote healthier recoveries for patients. It will also enhance the short-term solution of patient interaction videos by only focusing on clinical empathy and teaching the severity of the issue and what they can do to ultimately solve this problem. It also encourages therapists to strengthen their empathetic attitudes and improves patient recovery and well-being. Feasibility. Creating a course and adding it to the curriculum of DPT programs will cost money. With this being said, I believe that increasing student tuition is a good idea for Doctor of Physical Therapy School to provide what is needed in the end. And to make this work, instructors for this course are necessary, as well as textbooks to serve as a resource for students to learn effectively. Increasing student tuition can be very risky, but the outcomes from creating this course and adding it to the curriculums will outweigh the few hundreds of dollars for this course. So what is the positive outcome? It will lead to yourself and your loved ones to have more healthier recovery processes in physical therapy and a better well-being altogether. So, conclusion. Creating this course is crucial in making the field of physical therapy effective. That is how important it really is in creating this empathetic course. So what can you do? You can realize the severity of this issue and begin taking the steps to adding this vital course to your curriculum. How will it ultimately affect all of us? This will affect all of us because physical therapy is the only way for us and our loved ones to overcome an illness or injury, meaning that if physical therapists begin to realize how important possessing an empathetic attitude really is, then it will ultimately lead to healthier patients, including us and our loved ones. Is it worth it? This solution is by far 100% worth it and worth the work, being as it will most definitely strengthen empathetic attitudes of our therapists who are important people in our lives and in the field as a whole. Thank you, and I hope you have a great evening.